Hi everyone. I am an average American citizen who is interested in health and science. Therefore, I create this movie about wound and wound care. Like me, many people play sports and get injured frequently. Therefore, I create this little movie to teach people about wounds and some wound treatment. Also, to provide general information about chronic wounds like diabetic foot ulcers and venous leg wound. And to provide people with some basic facts about the structure of the skin, and to distribute information on wound care products. Remember, you should consult and listen to your doctor, because your doctor is the best source of information about taking care of your wound. Thus, check with your doctor if your wound is deep or you do not know how you got it or you think it may be infected, or it is not healing as expected. Foremost, I introduce you to some wound-related vocabulary. You should learn these vocabulary words to enhance your vocabulary. Abrasion. It is the wearing away of the skin through some mechanical process. Abscess. It is the accumulation of pus enclosed anywhere in the body. Cellulitis. It inflammation of the tissues indicating infection. Collagen. It is the main supporting protein of the skin. Debridement. It is the removal of foreign material and dead tissue from a wound. Edema. It is another word for swelling. Epidermis. It is the outer layer of the skin. Erythema. It is the diffuse redness of the skin. Eschar. It is the thick crust of dead tissue scab. Exudate. It is the accumulation of fluids in a wound. Full thickness. It is tissue damage extending through the dermis. Granulation. It is the formation of connective tissue in many new capillaries. It looks red and rough. Necrotic. It is another word for dead. Partial thickness. These are wounds that extend through the epidermis but not through the dermis. Pus. It is the thick liquid made up of white blood cells and bacteria. Slough. Stringy. Necrotic tissue. It is usually yellow. Ulcer. It is the loss of skin with definite edges. Wound. It is a break in the skin. The skin. The skin is the largest body organ. Its thickness ranges from thin in places like the eyelids to thick in places like the soles of your feet. The skin is divided into 3 layers: the epidermis, dermis, and the subcutaneous tissue. The epidermis is the outer layer of the skin. It sheds and replaces itself every 4 to 6 weeks. The dermis is the middle layer. It contains blood vessels and nerves which provide strength and support to the skin. The subcutaneous tissue is the bottom layer. It provides a cushion and nutritional support for the skin. The dermis and subcutaneous tissue are moist. Therefore, wounds heal faster when it is kept moist than when it is kept dry. Functions of the skin. The skin protects us from dangerous things like ultraviolet radiation and infections. The skin allows us to feel when we touch. Because the skin has nerve endings, it allows us to sense heat, cold, pressure and hurt. Furthermore, skins help us regulate body temperature and produce vitamin D when exposed to sunlight. Skin care. There are many things that harm the skin, like ultraviolet from tanning or sunlight, or chemicals we use in our homes and at our workplace, or alkaline soaps, or the drying of our skins resulting from our heating system. Fortunately, we can do many things to take care of our skin, like try to avoid the above, and intake plenty of fluids and nutrition, and gentle cleansing, and use moisturizer, and use sunscreen. The basic facts about wound. A wound is a break in the skin caused by trauma, disease and/or injuries. Most minor wounds like blisters, small cuts, and scrapes heal quickly. Thus, medical care is not needed. Acute wound is one that happens suddenly. The cause is known, and heals in a proper way. Chronic wound lasts for a long time, or reappear after some initial healing. There are diseases that cause chronic wound. Wound severity. Partial thickness. The wound penetrates through the epidermis and into the dermis. Full thickness. The wound extends through the dermis and epidermis and may affect underlying structures such as subcutaneous tissue, muscle, and bone. The wound healing process. After an injury, cells like white blood cells, platelets, fibroblasts, and epithelial cells clean up the wound, kill bacteria and viruses, and begin to close it. Shallow wounds can be covered with new skin within a day or 2. Deep wounds begin the process of healing by filling the wound with new connective tissues, which looks dark red and rough. Then, new blood vessels are formed. Then, contraction, which is the process of wound pulling together. Eventually, the wound is covered with new pink skin cells from the outer edges toward the center. Scar could form as a result of your body remodeling the new tissues.